back towards the end of the wall here. Both of them come out, and that's what we use to make sure that the patient is in the proper position each day. So once we've done that, then the table may move a little bit. The gantry wheel, this is called the snout. This is actually called the snout. There's 3 different snout sizes. There's a 10 centimeter snout, an 18 centimeter snout, and a 25 centimeter snout. And that snout is basically why you guys are scheduled where you're scheduled. This is a 18 centimeter snout. So these 2 devices hook right into here. And I kind of call them your medicine cups. It's kind of what doses out the proton in a medicine cup form. But you can see the ridges. The deeper the ridge, the further in the protons go. Whereas, you want to feel it? Whereas, so we're talking, this is like the tumor space. It's acrylic, and these are the things that you guys will take home with you if you want them.
Is that one completed? That's what.
So this is actually one of maybe 2 or 4 fields that you're being treated. So I'm gonna, just for sake of example, Leela has 3 spots, circles, treatment angles. So she would have 3 of these and 3 of these that would match each other. So this brass piece goes right over here, and it's kind of like a cookie cutter shape. They actually match right into each other. And the protons won't go through brass, and so protons stop all but in this cookie cutter shape. And so that's why I call it kind of like a medicine cup. It doses out. No, no. These are extremely heavy. I don't think you want them in your luggage, and they are radioactive for, I think, 2 months after we use them. So they go up to a storage room. They're put away for a long time. We melt them down, and then we reuse them once they're. Yeah, they're well, most of them, I would say, yeah. They're locked away in a secret storage that nobody can get to.
Are all 3 the same as this?
All 3 are the exact. To be honest with you, the only difference is this wall is blue, whereas the other one is red or yellow. Now the yellow one, because we're treating prostate patients, and that's all we're treating on that gantry, they actually have a false floor. So like I could walk onto the floor, whereas we don't have that here because the gantry wheel spins all the time, you know, for different angles that we're treating in different patients. So as opposed to your prostate, you know, we're treating one spot. That's it. But head and neck and other, you know, breasts, things like that, that gives us the capability to treat all of those things.
That spins, does it?
It does. This spins. It's like somebody said a hamster wheel, but yeah, it spins in a circle. Yep. It goes all the way around.
Is it quite slow?
It is.
Yeah.
I would say so. I mean, I think. It's not that fast. Leela, do you think it's fast?
But it's not fixed. The snout is fixed.
The snout is fixed. So this will spin around with the actual gantry wheel. Yeah. And so the reason for that is because, okay, so Leela's here and the table is spun over here. Well, we'll spin the table to like this, and we want to treat this would be over here. And so we're treating this field. So the table would be here, snout down, kind of over here, angled to her treatment coordinates, and then that is where we.
What about the top of the head?
We can do the top of the head.
Oh, right.
Depending on patient and treatment plan and things like that, sometimes we'll go from, so the snout will actually be right down here, and so we'll treat through the table. And other times, again, depending on the treatment, you know, field, the table will rotate, it'll be like this. And so the snout will have a direct angle to there. So a couple, Grace, this one's for you. A couple of sounds that you'll hear during treatment. Or is that clicking? And the only reason you hear that quick clicking, usually I'm doing it a little louder than normal, only because I want her to understand what it is. That's just us changing your medicine cup. And remember, you felt the medicine cup? So all that does is just slides into here, and then we shut it. Okay? Some other sounds that we hear in here is a regular doorbell. So we make a ding, and that lets the patients know that we're ready to treat, we're about to leave the room. And when we leave the room, we always have cameras, there's always audio, and we're only ever out of the room maybe 2 to 4 minutes, I would say. Depending on, because we have 3 gantries, and we have 1 beam line, 1 cyclotron that's housed at the back of our center. The cyclotron has a beam line that goes to all 3 gantries. And so only 1 person can have the beam line at one time. So the beam line might be, so we might be here on blue, waiting just for 2 minutes until it gets done with red and then comes to us. Does that make sense? Yeah?
Yeah.
Okay. Great. Glad. So some other noises that you'll hear are, I have my iPad, I think all of, when we go back outside, you remind me, I have the snout making the noise that it makes when it zooms in and zooms out on my iPad, so we'll be able to listen to that.
YouTube. Hey, we're going to hide.
Ooh, cool. Yeah?
But you only put one out in it, one time. But we have two ladies. So you put both in, or you just
No. We only, so kind of how a typical day is in here is we'll have the patient come step up, get on the table, we'll either put their mask or whatever immobilization. Sometimes they don't need a mask, sometimes they have the bean bags, that's their immobilization device. So we'll set them up, and a lot of you guys, your sticker, during your CT simulation, remember, Grace, we had tape put on our mask?
Yeah.
Yeah, you remember that? So what we'll do is we'll line you up to the best of our ability with the lines that we've already placed on the mask. And I'm just talking these, which is what we did on the CT simulation today. And then we'll swing them out. These X-ray panels will come out, and we'll take some X-rays. Now, when they're doing that, we're still in the room. We're just right behind this glass wall here. And it's a quick picture. I'll be right here. The patient saying, "You're doing a great job. You're holding so still. I'm so proud of you. We're going to take another picture. I'll be right back." And so I step back there with all the therapists, and then I come right back here and plan it here until we have to leave the room. And so while they're doing that, once the X-ray is taken, there's these 2 computers right here. One computer has the CT simulation day, the CAT scan that we took, and the other one is an actual X-ray of what we just took. And so we're fusing those together to make sure that they're lined up in the exact same position that they were lined up in. So once we verify that they're in the same position, then we can go ahead and treat. So what we would do then is we move these X-ray panels back. We'd put this and this into our snout, close it, ring the bell, leave the room, and then the same exact thing. We'd come back in. Now the first day is different than all the other days because the first day we take pictures in between each treatment field. Every day after that, once we've taken the setup field, we don't have to go through all the other ones. And so the X-ray panels only come out at the beginning of their treatment. So I don't know if you've noticed, or Leela, if you've noticed, the X-ray panels come out at the beginning of the day, and then they don't come out anymore, like during your treatment. Unless you're really moving, or unless they have to set up again, or something kind of just out of the normal. But after that, we come back in,
Yes.
switch these out, ring the bell,
You're okay.
go
You're
back
okay.
out.
Stand
You might
there.
have to move
Stand
the
there,
table, you know, depending on, like, for instance, if we're treating
Stay there,
here, we might have to move the table to this side, you know, things like that. But other than that,
So interesting.
once we had, to be honest, the part that takes the longest, and I think Dr. Danny, Dr. Julie, everybody has told you this, is the setup time that it takes. Treatment itself, I mean, when we're back there, I say we're out of the room for 2 minutes, but you're only being treated for like 30, 45 seconds in the 2 minutes that we're out there. So, if it's cold, we provide blankets. We have warm blankets that we'll go get. We have sheets. We've got fleece blankets that I have up at my office that Grace, you can pick whatever you want. Leela has a nice one that she keeps in her cubby. Trying to think, yeah. Well, that's the other piece that is not.
Is it
Gentle.
there?
Yes, that's it. Yeah. Thank you. Yeah, so this is. Oops.
You
So
won't get
this
that.
is the other piece. So this would be on this side of the table. And then the mask would hook on right here. Now remember, most of you guys have these pillows. Yeah. Grace, you remember the pillow we made for your, you remember that?
Just ask him nicely.
It is, yeah. But it's, I've made it a pillow for myself, and I'll tell you that it's a lot nicer than having it just be this, because it's her head. It's her exact,
don't fall
like
off.
it's just not a random
No,
pillow that we place. We place
Eve?
it, we mold it
On that
to your
stick.
exact
You have one of those?
head, so.
A pillow?
No, there's another piece that goes here. It's that one up the little padded one that you see hanging on the wall over there, at the back of the wall.
It's soft.
Right, it's not a bed, I will say that.
Grace, you okay,
But
darling?
it's not a hardboard either. It's not this. She has a little more, there's a little more padding in there than.
And the
than
blanket
what-
goes on top or underneath as well.
we put a sheet underneath, and then the blanket, whatever they choose, goes on over them to cover them, more for comfort than anything. There's a sheet though that does cover all
Don't
of
touch
this
Grace,
kind of
Grace.
Is it dark in here?
No, I would say it's about this light. Now, we don't have the red lights. Usually we have the red lights on, and that just helps us line them up to their mask each day.
It's quite a narrow table and quite long laid out.